It is one of those topics that is sometimes very difficult to talk about, but it's so needed that we do talk about this. Community Health Network has just launched a life-saving text service as part of its Zero Suicides initiative. This is a new way for young people to get help. And here to talk more about this service and how it works is Suzanne Clifford. She is the Executive Vice President of Behavioral Health for Community Health Network. That is a mouthful.
It is, it is.
Suzanne, I'm so happy though that you're here because we have covered so many stories where the tragedy of losing a child is front and center, especially a child when there is suicide involved. Why do you feel we need to talk about this? How big is this problem?
This is a huge issue. It's the second leading cause of death among youth in our state from 15 all the way to adults to 34. And there's more teens thinking about suicide in Indiana than any other state in the nation, according to the U.S. Department of Health.
Now, that is something that's very important to point out. More teens here in Indiana contemplating suicide than any other state in the U.S. So all of us, of course, know a teenager. We may not have teenagers, but we all know a teenager. We're not just talking about suicide, but we're talking about a lot of the things that lead up to suicide.
Absolutely. And so what you're doing today and us talking about this will save lives. About 1 in 5 teens are thinking about suicide, according to this study, and about 1 in 10 have actually tried to commit suicide. So you absolutely know somebody who has tried or has thought about suicide.
And a lot of parents, a lot of family members don't realize that there may be a teen right in front of them dealing with these struggles. So let's talk about why you're focusing on the texting service. Why texts?
We want people to get help any way they can. And what we're seeing is youth are using texting, and even adults are using it too. Sometimes you don't want to talk to somebody, but texting is a little bit more comfortable. And so we just want to have so many channels, 24/7 crisis lines, 24/7 walk-in clinics at Community Health Network, as well as now texting.
So I want you to show our viewers exactly how this works, how easy it is in case there are people watching right now. So someone texts your crisis line, is it?
Yeah.
Okay.
So all you have to do is you text help now to 20121, and then you put in a little bit of information that they ask you, and then we'll start talking with you. The crisis line will actually say, you know, hello, Suzanne, you know, I give them my name, and then they start talking about it, and they ask what the problem is and what can we start to do about it, and then they actually help, especially youth, get to a trusted adult. And make sure that that connection is made so that we can prevent suicides.
And very quickly, because I know we're running out of time, but you're already seeing results from this almost instantaneously.
We are. We put out a press release, and almost immediately we started getting results. We actually had somebody text from another state, and we were able to link them with a crisis hotline in another state. So this is going viral.
It's going viral. It's a life-saving tool. We want to make sure everyone knows about it. Suzanne, thank you so much for coming in, and we want to know more about this as you guys continue to grow.
Thank you. You'll help save lives here.
Absolutely. All right, Dan, over to you.